Telling stories is what humans do to make sense of the world when it's gone haywire. We use our stories to help show each other how to get through difficult times. And that's exactly what today's guest on Healing Words has done. Lynn Devlin has dedicated her career to using her stories to help other people who are struggling. Lynn is a board-certified hospice and palliative care nurse practitioner, and she's the author of several works, including Cancer Widow, The 7 Stages of Alzheimer's, and the Caregiver's Journal. In Cancer Widow, Lynn tells the story of how she and her husband navigated the healthcare system after her husband was diagnosed with stage 4 cancer. This is the story of a family dealing with cancer, but it's also the tale of an insider of the healthcare system who suddenly realized even she wasn't equipped to handle the journey even after years spent studying medicine. Now, in the interest of full disclosure, Lynn and I know each other very well. Cancer Widow is a book that I co-wrote with Lynn. And we found that we both believe that storytelling is a way to transform pain by using it to help other people. This book is part memoir, but it's also part advice for caregivers. Lynn, thank you so much for being on the show today.
Thank you for having me, Jackie. Very exciting.
Absolutely. So to get started, I would love to have you talk a little bit about what your motivations were for doing this book in the first place. Why did you want to do this?
Well, I think a big reason why I wanted to do it was to get some information out there. I think coming into a cancer diagnosis is so much that you really don't know ahead of time. And I think to look at the information ahead and be prepared is essential.
Yeah, oh, absolutely. It makes it that much, not easy, but it helps because there's so much that you don't know.
Exactly. And when you're newly diagnosed, the learning curve is steep and quick. And this is a book I really recommend for folks to read the summer before a bad diagnosis, if anyone knows. To read it way ahead of time would be the best.
Yeah. Well, now let's talk a little bit about the story here that we have in the book, because now your husband, Kevin, wasn't diagnosed with cancer until it was in stage 4. And that's usually when symptoms start to make themselves known for people. And you went to go see an ENT, that your nose and throat doctor, and he was the one that said, your husband has cancer. And the quote from the book is, "I'm sorry to tell you, but it's stage 4 cancer. He probably won't live 6 months."
Mm-hmm.
So I would love to have you talk a little bit about how you and Kevin coped with that news.
Right. I think the difficulty is that he'd been going to his clinician on and off for a year, and cancer had never been mentioned. So to hear it this sort of late was just a complete shock, really, to both of us. And because it was a late stage, at a stage 4, we were immediately pulled into the medical system.
And you were coming at this as a family nurse practitioner.
Mm-hmm.
So you'd had years of medical training under your belt.
Right.
And one of the things that you said too in the book was that after this, diagnosis, after you heard these words, you said the doctor didn't explain the stages and I didn't ask any questions. I was a nurse after all. But that day in that room, I knew no more than anyone else. So if you don't know the information, how do people, when they're given a diagnosis like this, what do they do? Where do they go for information?
Right. It's extremely difficult. And the first place, of course, you'd go is to your medical team, who know your case better than anybody else. But in that place where I was a nurse practitioner in our community, there was so much that went into it. It's sort of the shock. The shock really surrounds you and carries you through. And learning about cancer is extremely difficult. As a family nurse practitioner, I took care of patients with the cancer diagnosis, but those folks usually were funneled off to their oncologist for treatment, and I really never saw them later in the disease.
Yeah.
Right.
So you also had this massive learning curve.
Oh my gosh, it was huge. Mm-hmm. Right.
so then along the way, not only did you have to learn the terms, the medical leads, you also had to figure out strategies to help you in the moment. And I love, one of the things that you talk about is that you're in the room with the doctor, and afterwards you and Kevin would argue about what the doctor said. So tell us about the strategy that you came up with.
Right. Well, Kevin was an engineer, and early on in the diagnosis, he said, this is just a math problem, and we can fix a math problem. And he understood the radiation and the rationale behind the chemotherapy. But we definitely did not agree on how to move forward with treatment. And we always took somebody with us to the appointments. And that person would almost write down everything that was said by the specialist. And then later in the day, on the drive home, this person could help us mediate and figure out really what was said and what we heard.
Gotcha. And that is a brilliant strategy, and I know it was born out of necessity. Are there other strategies that you used, during this medical crisis that you were able to implement that you would advise other people think about?
If we did, it was by the seat of our pants. I'm a list writer, and I would write down every question, every symptom, and I would pull that list out really at every visit. And he wouldn't want me to do that. He would always say that he was fine, things were going okay, until I got my book out.
Yeah.
Right, and then it would turn into a different conversation, I think a more real conversation during that office visit.
A more real conversation with the doctor?
Mm-hmm. I think so. Mm-hmm. I think so, and it was difficult stuff. I think when you're going through chemotherapy or radiation, you expect certain symptoms, but I think to talk about it, again with a third party who really understands what's happening and it helps us to frame it, was very helpful for me, and I think Kevin also.
Yeah. Well, and one of the things I love about this book is that you are not afraid to talk about anything. And you're like that anyway in real life, which is what I so appreciate about you. You are not afraid to talk about anything, about the difficult stuff. You are the one out starting conversations about really, really challenging things. And I really do think that that's one of the gifts of this book that you've given to people, is the ability to put names and to put, to really permission to talk about some of these really difficult things. And in chapter 6, I just wanted to point to one of those places, because chapter 6 starts with this sentence: dealing with a guy who has cancer is hard. And you go there, you talk about that.
Right, and I think that's the first time I've ever read that or heard that. There's no website that really says this is really a difficult thing to do. Their personalities change, they're sick, and you're not used to dealing with somebody who's sick. And I hope that this book really does normalize the experience. Cancer is such an abnormal disease, it's an abnormal treatment plan, everything about it is just so abnormal, but it's specific to the patient. And so what one patient goes through with a certain diagnosis isn't the same as everybody else with that diagnosis. Mm-hmm. And there's not a lot of support around that, especially when you don't know the questions to ask. But one of the great things about the book has been when women come up to me and say, oh my gosh, we went through that, and they nod their heads to part of the book, and that makes it very important to me.
Well, and I would imagine that you've also given the people who've read this book the permission to just feel what they feel, right. And those hard things. And so, because you ended up being a caregiver, and a lot of the people watching this show in the rooms are caregivers, and you really talk about, you had a broken bone in your foot for a large portion of the time, and you didn't even realize it, and you were eating Cheerios and vitamin pills for dinner. You're in crisis, you're in, and there's, so can you talk a little bit about, from the caregiver's perspective, what are your strategies as a caregiver when you're in it? How do you take care of yourself? What advice do you have?
Right. I think there's no wrong thing to do as a caregiver, and by the time you're thrust into that role, there's really no rule books that you can read, and you have to do what works best at your house. With chemotherapy, there's so much nausea associated with that. We couldn't even cook in the house. So the whole focus became on him and his care, and we were happy to do it. But I don't think you really realize how deep you are into caregiving until it's over. It really was quite a very heavy experience. People are happy to give, but I think that it just causes all kinds of alterations in your own life. You give up your job, cooking, your family, and the focus became on getting him well.
Yeah. Well, and because I was a caregiver for my grandmother, as you know, who had Alzheimer's, and there are also moments of lightness, and it's not all, challenge and difficulty, even though that is certainly going on. But there are also moments of tragic humor, and this is the funniest thing I have ever seen when my grandmother is trying to get the dog's head, and why is the dog not sitting down, and the dog is upside down, and and it's sad. It's so sad, but there's also moments of brevity and laughter and lightness even in the middle of that. And do you encourage that kind of lightness in the middle of all of this?
Absolutely. And I wish we had had a little more of that, but now I look back and I think there were some really moments of connection over something that really was so awful. It just turned into the funniest thing ever. And I cherish those, and I know it helped us get through some really difficult times.
Yeah. Well, and I love that for you that they were moments of connection. I mean, that's really beautiful.
Absolutely. And I look back now and I just, I wouldn't change anything except the outcome of his disease. But, I'm very proud of what we did and how we were able to do it.
Well, and I think you should also be proud of the fact that, you're not just offering a memoir, this happened to me, this happened to us, this was our journey through this world. You're offering people an education. So, as I said at the beginning, this is not just a memoir. This is clinical information is included in here, and information for caregivers. And why did you do that?
I think it's because I felt like if I didn't know, maybe other people didn't know, and that has made the whole journey really worth it. Where people really don't know, I think in the face of a disease like stage 4 cancer, there's so much that you can't do anymore. And the book really, writing things down, reminded me of what we could do and what we did do to make things a bit better.
So the education piece, I want to kind of return to this because the education piece of this also talks about things that people don't like to think about, whether they're healthy, whether they're here at Mayo for an annual physical, whatever reason people are here in the room watching this show, there's going to be a lot of different reasons people are watching.
Right.
And you are kind of on a crusade right now to help people think about the end of life and end of life issues. And one of the things that you really struck me through this process of working with you on this was that, Kevin really set up a soft landing for you. And I loved how you had termed that there was all of this going on and really working to save his life. But he had also at the same time prepared for a soft landing. Can you talk about that a little bit?
I can speak to that. The single best thing Kevin did for himself and for our family was completing his advance directives, a living will. So he told us, actually, he had to do it for work, and he had done his 10 years ahead of time. And it was what he would have wanted toward the end of his life, care that he would and would not have wanted. And thank goodness I had that in writing, because as things heated up for him, these were choices that we didn't really have time to really go over in the moment. So thank goodness we'd had the conversations about what to do in the event of something overwhelming like this. So advance directives, or the living will, I think should be done when you get your driver's license. I think there should be an awareness about end of life, and I think it's so simple to talk about and write your wishes down.
Yeah. So at the time of Kevin's diagnosis, you were a family nurse practitioner. And then you went back to school to become a hospice and palliative care nurse. And I would love to hear a little bit about the palliative care philosophy, because Mayo does have a palliative care team here, and would love to hear what that's all about. And I don't think you had access to that when you were, or you didn't access it when you were going.
We did not have access to that. Okay. No, we didn't. And palliative care really is a medical specialty. So you go back to school and you learned the language of end of life, which is a completely different language of cancer or family practice. So palliative care really is a consultation with an expert in somebody who's been diagnosed with a life-limiting illness. And you can have, with palliative care, you can have medical aggressive therapy, or you can have medical hospice-oriented therapies. So palliative care is the patient, it's the family, it's medical issues, it's physical symptoms, and it's the emotional and spiritual piece. And our family needed that. Kevin needed that. No one really ever told Kevin that his time was limited. They told me, well, he was under anesthesia. You know, and that altered our marital relationship. It altered everything. And no one really ever did speak to him. Even though I would think there were opportunities for that, I would have thought that that would have been something that his clinicians should have brought up to him. He would have been happy to hear, happy to talk to that.
So the palliative care specialist is the one who brings that up and talks to it and says, this is what's going on. And
right, and this is what it looks like today. Yeah. And the oncologist speaks to what it looks like in the best case if the treatment works. The palliative care person speaks to symptoms that the patient's experiencing, and also, you know, what if this doesn't exactly go as planned?
I see.
Right. Going into the treatment, Kevin understood that it was very aggressive medical treatment, and the treatment alone could have taken his life. But I think that would have been a reasonable conversation to have with our medical team.
I see. The fact that you decided to share this story with everyone, I feel, is incredibly generous of you. But I wanted to know, you know, we talk a lot on this show. The show is called Healing Words, and it's called that for a reason. And there's a lot of research that says that writing helps people kind of move through difficult traumatic experiences and helps them, you know, not in some Pollyanna way, like, I'm suddenly better, but it really helps you move to a place of deeper understanding of yourself or of some piece of acceptance about what has happened. And so, you know, this show is really about how writing can help you heal. And I would love to know how the process of writing this book has landed for you and helped you heal.
Well, I think that in my list writing, I was already starting some sort of book. I don't think I ever wrote a journal type thing. I just would keep turning the page, and then I would throw in a word about how I was feeling or what was going on that needed to be addressed in that moment. And then looking back over those papers, over those lists, there were themes, and it really takes you right back to that moment. And it is very healing to write down, you know, take that one word and make it bigger. And then the next go around, you make it even bigger still. And the next thing you know, I met you. And it's in print.
And here it is. That reminds me, now, the other thing is about the healing part of all of this, that what you just said about you just wrote down a word, and you just wrote down another word, and you wrote down another word. I love that, because a lot of the people that are watching the show don't consider themselves writers, or maybe even uncomfortable writing, but we always offer, we have the guest offer a writing prompt, and I'd love to hear, I mean, it sounds like that would be a really interesting exercise.
Just to write the words.
Just to write a word. Can you offer a writing prompt?
Well, when you were going through something like this, I think any words you can get out of your head and out on paper helps. And it doesn't have to be a huge sentence. It doesn't have to be pretty. It doesn't have to be in a journal, or it doesn't have to be typed. I've got a bunch of stick-it notes. I think you've seen them. And just one word, get it out there, and go back to it later.
So we don't have to do sentences. We don't have to do paragraphs. We don't have to do big, you know, we don't have to write a book. We don't have to do that. We can just write down words about our feelings, about what's happening, about the room.
That's right, about specific situations. And I would go to bed at night and my head would just keep going. But once I started writing things down, that actually got much better. I know, and it takes time. And again, the one words, you go back a few months later and a few months after that. This book took about 5 years to bring forward. And it couldn't have been done any quicker, I don't think.
Well, and on that note, I wanted to read a quote that's a testimonial from the cover of the book. And it says, "Cancer Widow is powerful and painful. It should be read by anyone who loves another human being." Well, so I would love to have you read from the book to all of us who love other human beings.
Thank you. Chapter 9, Reconnection. I worked as long as I could, and until I couldn't stand it anymore. While I longed to be with Kevin, I wanted to be as far away from the sickness as possible. I never acclimated to the shock of seeing Kevin's body deteriorate. I was terrified of what was happening inside him. He'd always struggled to lose weight, but now I could see his ribs. On the outside, I felt calm, but inside I screamed constantly. I couldn't cry. I had to put my feelings into a compartment where the sadness and fear couldn't get out. My shoulders shook with unshed tears. It was the first Tuesday in March, and up until that point, I'd attended every single one of Kevin's appointments. But on that day, I was due to return to work. I dropped him off right in front of the cancer center doors and waited until he made it inside. I cried the entire drive to work. The minute my coworker walked into my office, I started bawling again. This woman was not known for her overwhelming expressions of compassion, but she went right to the HR person and told them I needed 7 weeks off. All of my patient visits were canceled, save for the first one, who was a young woman. "You're pregnant and due in November," I said, sharing the happy news. All I could think about was Kevin. I was afraid he'd be long dead by the time this woman's baby was born. After I ushered her out of the office, I drove back to the hospital with tears in my eyes. I reported to the receptionist in the cancer center, who told me to go right to the cancer suite. I walked down that tunnel of hallway with my heels clicking on the floor. No employees were in sight. Every exam room door was open, and I peeked in each one as I walked by. Nope, not that one. That's the turban lady. Nope, not that one. That's the one with the old guy's feet. And suddenly I saw Kevin in the last room straight ahead. I walked faster, and he sat with his head down looking at his sneakers. He still wore his green Philadelphia Eagles jacket and the Eagles hat he always wore. He heard me, and he looked up with an expression of such joyous recognition and pure relief that I knew immediately that I'd made the right decision. My old job was over. My new job had begun. From that moment on, I would be a full-time advocate, caretaker, comforter, GI tube feeder, dressing changer, medicine passer, pulse taker, and nagger. I promoted myself to providing care at the bedside or beside his recliner, where I would crouch on my knees in supplication, prayerful caregiving, and silent begging. Instead of checking in with colleagues, I would bargain with a higher power. Please let me be strong. Please don't let me hurt him. Please don't let him see me cry. Please let me comfort him. Don't let him puke. Don't let him be cranky. Please don't let him ask me questions I don't know the answers to. And when I stopped working, we started looking at each other again. We were side by side, and any stress from the tough times in our marriage just melted away. Words became less important. Presence was the most important thing.
It's not easy to deal with a medical crisis. It's painful, confusing, unfair, and even downright terrifying. When Lynn and her husband Kevin were dealing with Kevin's diagnosis, Lynn kept a journal throughout the process where she worked through every emotion she felt along the way. Here are some things that she wrote in her journal. "He acts like I'm stupid. From now on, there will be no advice, no pressure to go to the emergency room or get hard copies of the lab results or discuss test findings. Nothing is right for him. The recliner, CAT scans, how much information I share with people. Enough already. Let his family come help." Another time, Lynn wrote in her diary, "I want the old Kevin back, the one who helped out in all the unseen ways that spouses do, the one who showed concern for the kids and me. I want my husband back." Today's writing prompt is to write down everything you're feeling. Just really let it all hang out. Don't be polite. Don't hold back. Speak your truth. It's up to you whether you want to keep the writing or burn it or shred it when you're done. But let writing be your companion through this medical crisis. It will help you find your way. Thank you for watching Healing Words, brought to you by the Center for Humanities and Medicine at Mayo Clinic. I'm Jacquelyn Fletcher. If you'd like to try some of the exercises you've heard today, you can ask your nurse to contact us, and we'll get you a notebook and pen. You can reach me with any thoughts or suggestions, or arrange to have a writer visit you in your room by using the contact information on the screen. I'd like to send another big thank you to Lynn Devlin for joining me today and for sharing her heart with us. Until next time, be well.